in Jamnagar. I'm indeed glad to be here after 15 years. The problem here is the topic, workshop, and the time allocated, and people sitting on a chair. In workshop, there should be some karya. Yoga is a science of practice, not a subject of discussion. So here probably again I am stuck up with the difficult task of giving you only a lecture probably. And just imagine, I have to talk about diabetes. Many may not be aware with the clinical detail of the diabetes. Many will not be aware of the complications of diabetes. And plus, the allopathic knowledge that has to be correlated with yogic knowledge, and plus that too in therapeutics. So combining or uniting or yoking or joining so many, जिनका योग बोलते हैं, ये करना थोड़ा मुश्किल है. If I talk too much, that may be boring, but that introduction will have to be given. So first is, what is diabetes? In clinical conferences, there is a lot of debate about what are the causations, type 1, type 2, genetic diabetics, monogenic, MODI, you have heard about those numbers, LEDA, gestational diabetes, so many things you must have heard, but they are essentially for allopathic practitioners at conference levels. But one thing we have to understand, that diabetes is exploding like anything, and India has earned the notorious label of being the diabetic capital of the world. ये चाहिए क्या अपने को? Do we want to be known for this? Of course no. But yet, that is a sad truth. About 15 to 20 crores of diabetics exist in India. Just imagine the number. वो 40, 10, 15% will have diabetes. Diabetes है तो क्या होता है? Immediately there is no problem. But as the years progress, as the control or uncontrol, and most likely uncontrol or non-control of diabetes progresses, there is progression of various complications. And these complications affect all the vessels, the entire body. In fact, diabetes should be labeled as a holistic disease that affects the whole. So we have young patients suffering from myocardial infarctions. Myocardial infarction due to non-diabetics is a different story altogether. But diabetes makes you prone for getting heart attacks early, getting strokes early, getting kidney failures early, getting amputations early. All the vessels are affected. So if your limb vessels are affected, you'll be prone for non-healing wounds, amputations. If your brain vessels are affected, you will get strokes. If your heart vessels are affected, you will get heart attacks. If your eye vessels are affected, you will get blindness. The commonest cause of non-accidental or non-traumatic amputations is diabetes. The commonest cause of blindness after cataracts is diabetes. And can we prevent this? Common sense answer. Leopard disease, you need not be an expert. Can we prevent this?
Yes, sir.
No, of course no. Otherwise, why are the numbers growing exponentially? A brief idea about how the study, allopathic study of diabetes started. About 100 years back, roughly, the insulin was discovered. And the inventors got Nobel Prize. Then in the 50s and 60s came certain drugs. Initially metformin, what were called as biguanides. In 80s and 90s came the sulfonylurea. And then since 90 onwards there is an explosion of medicines literally. So what this proves is that we have insights into the causation of the disease, into various causes of the complications, but there is no insight into prevention because the incidence would not have gone fourfold. Diabetes is increasing in all age groups, all residents, whether they are urban, whether they are semi-urban, whether they are rural, whether they are semi-rural, whether they are students, whether they are elderly, so much is the number that it's worrying for everyone because it is an affliction of the society. So here we have therapeutic advances which can make a diabetic patient survive. But if you look into the aspect of prevention, sadly none exists. So medicine is doing its job, but can there be any other thing to mitigate this disaster? Bomb ही है वो. So medicine has a limited understanding. So what initially started with understanding of the pancreas gradually progressed, and then people found out that okay, liver is also a defective organ. Then even intestines play a role in causation of diabetes. Even kidneys are involved, even the brain is involved, even the muscles are involved. So as the understanding is progressed, we are coming to know of various insights, the details of which are not important here. But these insights are definitely progressing. But as the problem is increasing, can there be a collaborative efforts, collaborative study, or any combining knowledge of various faculties or various other branches to help the general population? And friends, I will certainly say that here yoga has got a lot to offer. Allopathy uses external medicines. Even in Ayurvedic, these are all synthesized chemicals. Even in Ayurveda, medicines are used, but they are vanaushadhi, you can say, they are from the plants. But you require an external object to act within and to create some effect. The brilliance of yogic science is that it uses your own body to target various organs within. So whatever chemical you take in, or whatever plant medicine you take in, goes in, it is absorbed, it will reach the site of action and produce various actions. But in yogic science, you are supposed to use this entire body, no external agent, and to keep itself healthy, keep various organs healthy, and maintain your health. Of course, the aim of yoga is not health. Your aim of yoga is to unite the Jivatma within us with an individual consciousness, or individual Jivatma is a part of cosmic consciousness or Paramatma, which Arpan had mentioned just now. Yoga is defined as Ashtanga Yoga. It was given by Patanjali, Yogena Chittasya Padena Vacham, Malam Sharirasya Javaidakena. So for the Chitta, Yoga was given. For communication, Sanskrit was given. And for diseases, Ayurveda was given. The originator of all these three sciences is the great sage Patanjali. So, out of this, medicines are available, but can anything be available to maintain one as it is? To maintain an individual as healthy as he can be with least use of external agents? Yes, friend, yoga certainly has that potential. And how, I shall try to explain. Now, this being a workshop, we may give certain demonstrations. So first we have to understand what is meant by yoga, which I have mentioned previously, that it is a union or joining, or yoga. Yoga means to, yuja means to join or to bind. So you have to bind that universal consciousness with the individual consciousness within. It is a self-enforced discipline. Atha yoga anushasanam, says Patanjali at the beginning. And friends, chronic diseases, non-communicable diseases, उसको और एक term use किया जाता है. Can anyone tell me what that is? All these diseases, they are called as lifestyle diseases. Lifestyle में क्या घपला किया है 100 साल में कि इतना बढ़ गया है? So that lifestyle is as a result of indisciplined lifestyle. So that indisciplined lifestyle has to be disciplined. आप कॉलेज में जाते हो, स्कूल में जाते हो, you attend on time because if you reach late, you will be punished. If you are traveling on the road, if you break that signal, you will be punished. There is an importance, of course, that you have to know the rules. But our tendency is to break the rules. And if you break the rules, you will be punished. But if you will not be punished, will you follow the rules? How many of you will follow? Very few. आप इधर है कि नहीं मालूम नहीं. पुणे में आप देखो, no one follows the traffic rules. Everyone is going right, left, no entry, triple seat, drunken time, whatever. So this indiscipline on road is probably causing deaths to the tune of 1.5 lakh deaths per year in India. That's almost a world record. So friends, if we don't follow a correct lifestyle, we are prone for diseases. Why do we follow an undisciplined lifestyle? That is because of mental disposition. So you have to understand the Sankhya philosophy, which is the base for yoga practice. Sankhya philosophy states that the entire universe is made up of two principles. One is the immutable, unchangeable soul, or Paramatma, or Purusha Vishesha Ishvara. And what we can see, Vidrusha Jagat, that is Prakriti or nature, the ever-changing, restless Prakriti. And the entire universe is intermingling of Purusha and Prakriti. Prakriti is further divided. Everything exists within us. We have seen the Purusha Vishesha is the Paramatma. But the Prakriti is made up of various Stula Sharira, which consists of Pancha Jnanendriya, Pancha Karmendriya, Pancha Mahabhutas, Pancha Tanmatras. These constitute what is called as the Stula Sharira, or the gross body, which we can see. The Pancha Karmendriya, are the organs of action, to arms, to legs, the organ of speech, and the genital and excretory organ. Pancha Jnanendriyas are the sensory organs, the eyes, nose, tongue, ears, and skin. These are the sensory organs. The infraatomic components of the Mahabhuta, the Shabda, Sparsha, Rasa, Rupa, and Gandha. So these are the infraatomic components of these Pancha Mahabhutas. The Pancha Mahabhutas are Prithvi, or the earth element, Aap, or the water, the Tejas is the fire, Vayu is the air, and Akasha is the space. This is the gross body, which can be seen. What cannot be seen is called as the Sukshma Sharira, which exists all over. In allopathy, in other languages, that is, Chitta and mind is equated together. But Chitta is not mind. As we have classified the gross body, Yogic science has classified Chitta into various components. The subtle components are Manas, or the mind, the ever oscillating, fluctuating, indecisive character that is defined by the mind. The Ahankara, or the ego, or the I maker, that is the Ahankara. And the third component is the Buddhi, the right-wrong discrimination. The Buddhi knows that this is right and this is wrong, and we always follow the right. But the mind, because of its oscillating nature, shaky nature, is in the trap of dualities, desires. अभी lifestyle में इसमें क्या संबंध आता है? So if you see something, if you get something good, you will eat more. That is greed, and that eating more has resulted in क्या हो गया है? बीमारी सोसाइटी में. It's a question. Obesity. So obesity है तो diabetes है. This is all. अगर गरीब है तो फटे वस्त्र है, खाना बासा मिलता है, घर स्वच्छ नहीं है. So all those things are compounded. So obesity इतना बढ़ गया है, that is called as diabetes, because obesity contributes to diabetes. Diabetes contributes to obesity. So all these non-communicable diseases shatter our health within. तो ये एक समझ लेना कि the desire of eating which overpowers the mind, the इंद्रिया का नाथ कौन है? It should be mind. All the mind should regulate the senses. But रसना इतना पावरफुल इफेक्ट है उसका माइंड पे. So you eat and you find the obesity. Obesity in school children. किधर भी देखो तौन है, buttocks बड़े हैं, thighs are bulky, and that is causing so many problems that there is a pandemic of obesity simply as a result of inability to control your desire to eat. इसके लिए कोई गोली है क्या? हो सकता है क्या? So you understand that this discipline has to come from within. No one externally can guide you. Another question. Which is the most difficult subject on this earth? कोई भी, I mean guess. Let this be. इस धरा पे सबसे मुश्किल विषय कौन सा है? हाँ? योग. No, yog. And I don't say this. They have praised me whatever कि मैं expert. I am not an expert. I just happened, मेरे जन्म से पुणे में हूँ और that's the only qualification. I have nothing. And yoga is difficult, which I don't say. Krishna says in Bhagavad Gita, Yoyam yogastvaya proktam samyena madhusudana etasyaham na pashyami chanchalatva sthitim stiram. Chanchalam hi mana Krishna. Hey Krishna, how can I control it? Chanchalam hi mana Krishna pramati balavadrudam तस्याहम निग्रहम मन्ये वायोरिव दुष्करम. श्री भगवान उवाच, लॉर्ड सेज, असंशयम महाबाहो मनो दुर्निग्रहम चलम अभ्यासेन तु कौन्तेय वैराग्येण च गृह्यते. सो यस, हे परम मित्र एंड परम सखा अर्जुना, योग इज डिफिकल्ट टू रेगुलेट, इज एक्सट्रीमली डिफिकल्ट टू रेगुलेट द माइंड, इज डिफिकल्ट बट इट इज पॉसिबल. एफर्ट्स या तपस बोल दो, किस विषय में लगता है सबसे ज्यादा ज्ञान? किस विषय में लगता है सबसे ज्यादा कर्म? किस विषय में लगता है? The answer is probably in the previous question. Yoga itself, because even Lord Krishna says, tapasvibhyo diko yogi, jnanibhyo bhi matodika, कर्मिभ्यश्चाधिको योगी, तस्माद् योगी भव अर्जुन. हे अर्जुना, भी योगी. योगी जैसे तप कोई किसी का भी नहीं, ज्ञान किसी का भी नहीं, कर्म किसी का भी नहीं. So be yogi. Here we are learning yoga. You have to understand how we learn. कैसे पढ़ते हैं आप? In the education system itself. So these differences you have to understand. We learn from books, or we learn from what our teacher has told us. So beyond this book knowledge, we don't grow. And yoga cannot be learned from books. Some introduction, some explanation, this can be given, but it cannot be taught. You can be introduced on the path. When you progress, you have to assess your progress yourself. ऐसे तो कोई आएगा भी नहीं होगा. इतना मुश्किल है. When lakhs and lakhs of people are turning to yoga, it is a good thing that people are following a good subject. But when a classic subject becomes popular, there is a risk of danger and dilution and various other commercial things creeping into any subject. So if you become a yoga practitioner, see that you don't fall prey into those tendencies. Now, this is about the Sankhya philosophy base which students of Ayurveda and students of yoga should know. Now, Patanjali says that Ashtanga Yoga, 8 limbs, which are the 8 limbs of yoga, So, Yamaniyamāsana pranayama pratyahara dharana dhyana samadhayoho ashtavangani. So when you follow this discipline for days, weeks, months or years together, आपको BMS कितने साल मिलता है?
4.5
5.5 पोस्ट ग्रेजुएशन, सो 8 साल में एक्सपर्ट हो गए. What Lord Krishna says, अनेक जन्म संसिद्ध ततो याति पराम गतिम. So a yogi has to struggle for several lives. Life is not a barrier. You have to understand. जो अनेक जन्म जिसको लग सकते हैं, वो 5 साल में 10 साल में ये करके ये कर सकते हैं क्या? And if you have to unite, योग करते हैं, how many people come to meet God? You ask anyone. This I ask usually for all the classes. No one says, everyone says no, no. So everyone comes for fitness. ये गलत है या सही है?
गलत है. सही है.
योगा फिटनेस के लिए है क्या? Yes, of course it is.
Yes, sir.
If someone, if an innocent
क्या
practitioner joins
Physical fitness.
for healthy and physical fitness, ये सही है क्या? Yes, please don't blame any individual who comes or seeks to learn this subject. It is not, he may join for whatever purpose. किसी को भी अरे बाप रे ऐसे ये फिटनेस क्या है, ये अध्यात्म का विषय है, ऐसे don't berate anyone. Let him come for fitness. That doesn't matter. Do you need fitness?
Yes, sir. नहीं यार.
Do you need fitness?
नहीं sir. Life.
Everyone needs fitness. और फिटनेस क्यों चाहिए? योगी को क्यों चाहिए? नायमात्मा बलहीनेन लभ्यः. A feeble person cannot achieve anything. Even if you want to enjoy abuse, you require health. But if you want to progress on this disciplined subject, you require intense health. And if you are not healthy, what will happen? You suffer, of course. Even a thief will suffer, a criminal will suffer, everyone will suffer. But why does a yogi want to remain fit?
To deliver the best.
Because that's a barrier to his progress. Patanjali talks of various antaraya or obstacles in practice of yoga. So, which are the obstacles for your practice of yoga? He mentions navantarayas. Vyadhi sthana sanshaya, pramad alasya virati bhranti darshan, alabdha bhumikatvana vasti tatvani, chitta vikshepaste antaraya. So vyadhi is an obstacle for a yogi in the progress of his yoga sadhana. And how does Patanjali advise the eradication of vyadhis? It's just given in one sutra. Tat pratishedhartham ekatatvabhyasa. If you are a yogi, if you develop illnesses, you don't go to a doctor. You have to find the cause of your disease and correct yourself. Ekatatvabhyasa is the only answer which Patanjali has given to yogis, not for us. So remember, when a yogic person practices, he is bound to develop illnesses, which he has to understand and eradicate by ekatatvabhyasaha. So yogis can eradicate their ailments by ekatatvabhyasaha. So this is the connection you have to understand between where yogic therapeutics can come in. Yogic therapeutics कहाँ से आता है? I have learned in my Harrison medicine. Okay, I will just give you details how insulin works, how sulfonylureas work, how the GLP-1 or अभी Ozempic or all the newer weight loss agents. I will give you a detailed description of how those agents work. But how does a yogi understand diseases? How does he study diseases? And can he help someone? So you have to understand that when you practice, one of the most dangerous subject is most difficult, challenging and dangerous subject is. Now the answer should be simple. ये पूछता है तो एक ही आंसर रहता है, योगा. हाँ. So you require various mental qualities like courage, will to accept challenges And even if you injure or harm yourself, you should be able to overcome that. That's only when your bhai will go away. Otherwise, that fear is protective. Fear is not wrong. So in your practices, you have to understand that yoga therapy doesn't come from books. It cannot come from books. Yoga therapy comes from practices, from the practices of a yogi, and from the practices of a yogi. He guides his fellow sufferers or humanity who come to him for some problems. So उसका किताब में आपको किधर ये नहीं मिलेगा. You do this for this thing. Take insulin 20 units morning, 10 units night. ऐसे prescription नहीं है. This is not a prescription based science. If you are interested in using yoga as therapy, you should be a practitioner yourself, where you should have understanding of what the limitations are, how you can help a person without injuring. Remember, a suffering has a lot of fear. He has put faith in you and he has come to you for relief. So there it's your duty to help him. Don't tell him, ये दवा बंद कर दो, ये कर दो. He may continue with whatever medications he is taking. When he comes to you, whatever little help in his daily routine he can introduce and get help is your job. Your job is not to guide this thing. ऐसे हो सकता है, ये करो, ये छोड़ दो. Don't assume the role of a therapeutic teacher. Let them do whatever they want, and with whatever problems they have, they should be helped. Now we have seen that the 8 links are Yama, Niyama, Asana, Pranayam, Pratyahar, Dharana, Dhyan and Samadhi, which is the step. सौतेला मालूम है क्या?
Yes, sir.
Step, हाँ, step son या step brother ऐसा. So if you have 8 sons और सबको व्यवहार एक जैसे चाहिए, बट सबसे सौतेला अंग कौन सा है अष्टांग में? अष्टांग योग में सबसे सौतेला अंग कौन सा है? The most deprecated, most abused and most humiliated anga is
Niyam.
asana.
Niyam.
See, everyone says asana is physical. हाँ, उसका माइंड से कुछ संबंध नहीं. So if you get to see some such ignorant people, what will you do? Don't come under their sway. Laugh at their ignorance and you continue with your practice. So asana is the most abused, neglected yoga, even by yoga practitioners. That's the paradox. अभी सौतेला है तो लाडला भी चाहिए. तो सबसे लाडला अंग कौन सा है?
Pranayam.
अरे सबसे लाडला अंग. There are 8 only. Yes. Dhyan. Yes. Very good. Huh? So everyone wants meditation. Huh? Sitting at one place and closing your eyes is not meditation. That is tamasic posture, tamasic way of sitting. That will never lead you to dhyan. You have to understand that yama niyama are your external engagement with the society. Ahimsa, satya, asteya, brahmacharya, aparigraha. That you have to deal with others. Personal this thing is niyamas, shaucha, santosh, tapas, swadhyaya, ishwar, pranidhana, niyama. Then third limb comes, which is asana vishka. All other limbs are equally defective. Abhi which one is better? Shalya अच्छा है या स्वास्थ्य वृत्त अच्छा है या other कुछ? They all are composited one. So can you say that this is better? But if someone specializes, he earns proficiency in that and becomes a luminary. So remember that asana is a deprecated anga. Throughout, I think for centuries, everyone believes that it is physical. अंधविश्वास, ignorance, arrogance, कुछ भी बोलो. And this has been going on for centuries. Now I am thinking कि अरे बाप रे, कि मुझे what was the purpose of Guruji B.K.S. Iyengar? At the age of 16, he was introduced to only asanas. by his brother-in-law. There was no other thing which he was taught. And at 18 he shifted in Pune with paltry knowledge of asanas for demonstration. That's all. उसके बाद में उनको जीने का कोई साधन भी नहीं था. From 18 or 16 till 96 he had to practice that only for his survival. There was no means, बाकी कुछ था ही नहीं. And उसमें practice करके 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 he has brought it to such a level that it has been accorded its rightful place. The step treatment which was given now is eradicated. Now let me ask you, कि dharana, dhyan, samadhi, after asana comes pranayama. When you breathe, that indicates that you are alive. When your breathing stops, you are dead. So breathing indicates that prana is there in the body, and breath is a tool to regulate the prana. So that is a subtle science. You have to regulate the breath in such a fine way. That requires a tremendous attention, concentration. So if dhyana is required here also. But what do you see yourself? Kusti, it's wrestling. Wrestling is not pranayama. You are dealing with a subtle force. So puraka, kumbhaka, rechaka, kumbhaka. All these spaces are regulated to regulate the life force or prana. और उसका पूरा शरीर में आयाम. That is pranayama. And what is the relation of prana? See the interrelation of various angas. After achieving proficiency in pranayama, Patanjali says, dharana sucha yogyata manasaha. So with proficiency in pranayama, your mind becomes ripe for dharana. Pratyahara. विषय संप्रयोगे चित्तस्य स्वरूपानुकारेवेन्द्रियाणां प्रत्याहारः. So mind is dragged outwards. You have seen the simple obesity का प्रत्याहार नहीं है. Can an ordinary person achieve this? Impossible. The mind is dragged by senses. So you have to absolutely subjugate the mind. How is it done? Tablets, explanations, teaching, full discipline. You have to observe yourself. ततः परमावश्यते इंद्रियाणाम. So वश इंद्रियों को वश में लाने का, इंद्रियों में वश में लाने का तभी मन काम कर सकता है. मन को वश में लाने का तब तुम्हारा अहंकार आ जाएगा. तो अहंकार में इसमें लाने का तब बुद्धि आएगा. एंड देन यू हैव टू get that under control or raise your buddhi to the level of the soul. Then yoga will result. So you have to understand that dharana, dhyan, samadhi, deshabandhas chittasya dharana. It deals with subtle chitta which cannot be seen. When you focus your mind for a moment, that is dharana. Dharana maintained uninterruptedly for a period of time is dhyana. So without preceding limbs, this cannot occur. And then when the object on which you focus or have your attention becomes one with the dhyan, the subject, object becomes one, then it is samadhi. So remember that these are internal tools. Whatever activity you may do, this focus is required to progress. Maybe a dancer in his art, a singer in his art, a scientist in his subject. So this is a subtle tool of the chitta for progress. Just sitting at one place and hoping that you will meet God is madness. That cannot be dhyan. Please don't misinterpret as dhyan. लाडले के इसको डिसिप्लिन में लाना तो क्या करना पड़ता है? You see pampered child, they have to be hit. So all the limbs are equally important, and some who have mastered a particular limb have specialized, and they have we have luminaries, Lord Hanumana is known for which aspect of yoga? Bhishmacharya. That is a sub-anga. Brahmacharya. So you have to understand Brahmacharya. Brahmacharya at a gross level, consider that Brahmacharya is celibacy. Brahmacharya नहीं follow करने से क्या हुआ मालूम है क्या? How many lakhs have died due to which disease? Which disease? अरे मेडिकल से बोलो. unregulated sexual desires and sexual exposures, sexual exposures will give rise to which disease?
HIV.
All sexual diseases, but HIV has killed millions.
Yes, HIV.
So you have to understand the strength of each anga of yoga. So that desire, all medical science has struggled to control, and they have given up. So what has government policies recommended based on medical recommendations is he let people have sex, intercourse and free distribution of condoms. ड्रग्स लेने वाला आदमी है, व्हाट डू दे डू? इसका ड्रग ले लो, एंजॉय, यू टेक हिज नीडल. शेयर्ड नीडल्स इज अ कॉमन कॉज ऑफ HIV. So how do you tackle this? The desire to take drugs cannot be tackled. That mind drives that individual like crazy. You are not in control of yourself. The mind is in control of the senses. घोड़े ही सारथी को ले रहे हैं, the सारथी is unable to direct. So there again give sterile needles. Hospital में जाओ, you see for every patient separate needle is used. So अगर drug addict से ये free needles ले लो, at least use your needle for yourself. We cannot control your desire to take drugs, whatever, but at least take safe injection practices. So these are the way societies are tackled. That's a good way of. I'm not saying it's not correct. The main focus cannot be tackled. How will you tackle the desire to eat? Leave apart कि बाबा HIV नहीं, बाकी कुछ नहीं है. खाने का ये कैसे कंट्रोल करेंगे? Eating is as a result of your appetite centers, various portions of the brain, but mind is under the control of brain. This is what yogic science says. Medically, we are still confused whether brain and mind is one, but remember, brain is gross mind. Stool mind or stool is a part of sthula sharira, and mind is subtle. So you eat and you have common. 10वीं में देखो, 12वीं में देखो, one of my students, patients rather, at age of 19, weight is 160. At the age of 25, he'll have diabetes. At the age of 30, he'll have cardiac problems. At the age of 40, his knee will come for replacement. At the age of 90, age of 160. So उसको क्या करेंगे? So we are unable to tackle the main cause. What is done is bariatric surgery. जठर ही काट दो. जठर काटने से क्या होता है? Your weight may come down. If it is massively high, if you are massively obese, your diabetes may go, but that's not the recommendation for patients who are slightly overweight. There is a beeline or form. थोड़ा सा ज़्यादा है, मेरा वजन कम करना है. So that greed exploitation is also, we should not go. So diseases, causation, and their management and mitigation has to be a multi-team effort or multidisciplinary effort to relieve the suffering, whatever the disease may be. Today we will focus only on diabetes. And as I have said, that V.K.S. Iyengar is known for asanas. Using this simple limb of asanas, he has made this subject popular world over, and made it so popular that livelihood of several students abroad is based on this. They use this for udar nirvaha. So that is the level of popularity. And once again, with full responsibility, I say, 21st June is Yoga Day. The moment it was recommended, it was accepted the world over, because the preparation was already done by work of Guruji. Since 50s onwards, yoga spread like a wild flame by using only asana and pranayam by this great yogi. Now remember that when you progress in asana or any subject, you have to use dharana, dhyana and samadhi. Dharana and dhyana and samadhi make you developed in that subject, and you reach to a point where no one can understand what you are studying or what you have learnt. And at that stage, you have to put that difficult subject in front of others. Now, asana is difficult. मैं किसी को आके बोलूँ, अरे सिर पे खड़ा हो जाओ. All doctors will say, नहीं, spondylitis हो जाएगा. Who is likely to come and do? Courage is there more in youngsters. They will come. प्रोफेसर है तो डर जाएंगे, नहीं, मैं spondylitis हो जाएगा. But you understand कि Spondylitis develops in all persons who are standing on their legs for life. But डर कैसे अपने को रीजनिंग बदलने को करता है ये समझो. If you stand on legs and develop cervical spondylitis, will you stop standing on your legs? बट सर पे रहने का डर लगता है. सो yes, there are some injuries potential, but how to introduce those subject safely for regular practitioners, for non-regular practitioners, for sufferers, for everyone. Now here again, yoga is said to be a universal subject. युवा वृद्धो अतिवृद्धो व्याधितो वा दुर्बलोऽपि वा अभ्यास सिद्धिमाप्नोति सर्वयोगेष्वतन्द्रितः. Young, feeble, disabled, aged, extremely aged, all can practice and derive its benefits. That is what Guruji has also done. But I differ. I say that it is not a universal subject because I know I am facing the difficulties. Yoga is not a universal subject, but yogis make it a universal subject. When I say yoga is not a universal subject, I am correct because मैं कनिष्ठ हूँ. I have not reached that stage. But when you reach at that stage, you make it accessible for everyone. And Guruji has made asanas accessible for all, for their therapeutic benefits also. If you have diabetes, will you tell your patient, go and do dhyan? Will it have any effect? It cannot have. At the most, say walk, but is walking an exercise? Walking भी exercise नहीं है. So is asana an exercise? Let me put it this way. Asana is not an exercise. It is precise placement of various prakriti I have described in appropriate positions, in those positions which have been given by various rishis and munis. When prakriti is placed appropriately in those positions, then this Swarup Avastha is attained. So Asinat Sambhava, or Asina is Samadhi and Samadhi is Asana. Guruji has given the subjective experience of Samadhi in his asanas. That the body is the bow, asana is the arrow, and the target is the soul. And in perfect asana, this Samadhi is struck. That is the description. That is what we have to achieve. But when I have a problem and when I go for a problem, should I be talking about these lofty aims? My job is to help someone who comes to me. So let us understand about yogic science and medical science and how will we correlate this and probably help some of those diabetics. Now this is not a prescription. This tablet 3 times a day, this tablet 4 times a day. So based on practice of asanas, Guruji has given a lot of knowledge that asanas give at a gross level physical health. We have seen that the health of कर्मेंद्रिय. कर्मेंद्रियas have to be strong. Otherwise चलना भी नहीं आता है. You will need a wheelchair. So कर्मेंद्रियas have to become strong, and when they become strong, you have to use them for further progress. With strong कर्मेंद्रिय, you get access to the spine. Remember, and all the health, physical health, and based on that, further various aspects of health which Guruji has defined. They are not defined even in the WHO definition. It has been given by various committees. WHO says that health is not only absence of disease, but presence of physical, mental, and social well-being. Physical well-being किधर भी define नहीं किया है. Mental well-being किधर भी define नहीं किया है. Social well-being, see, yamas are social well-being. Mental well-being is samatvam yoga uchyate. All these are precisely defined in this science. Then you have higher aspects, the organic health, the mental health, emotional health, endocrine health, spiritual health, finally. So I'll just give some aspect of what Guruji used to say as organic health. A basic question, your health is dependent on what? Health is dependent on what? Medicos bata sakte hain, non-medicos I won't ask them. Or anyone you can understand. Muscles, exercise, activity. health is not dependent on your muscles. The gross part, the muscular body, you can say, muscular skeletal system, that can function if your vital organs are strong. If your vital organs are healthy, a person has heart attack and heart function compromised, he will not be able to exercise. His muscle will not able to work. They will not be able to work. Your patient has asthma, lung function compromised. He will not be able to exercise. See patients of kidney failure, nothing wrong with the muscles. So all these vital organs contribute to health. If they are kept healthy, then our body can function. So understand that we have to make the health by keeping these organs healthy. That is organic health. Now we are able to move our limbs. If I lift something, that is my karmendriya doing something. If I come on the stage, it's my karmendriya bringing here. But how can the karmendriyas be used to maintain organic health is what will be shown probably. But you have to understand the importance of what are called as organs. Liver disease, alcoholic, liver खराब हो गया, पेट में पानी, jaundice है, कुछ नहीं कर सकते. 80 kg will go into 50 kg and will perish. So how to keep organs healthy? We understand muscles are strong biceps, strong triceps. So muscles को कैसे use करके organs को healthy रख सकते हैं? And the subject of today is diabetes. So principally, which is the organ which is involved in diabetes?
Pancreas. Pancreas.
वो actually common knowledge है. Pancreas, हाँ. Pancreas, liver, and as the medical insights are progressing, we know pancreas, liver, intestines, kidneys, various organs are there. So how will you exercise these organs is a simple question. For us, we cannot. But you have to understand the genius of yogis. They have used various these karmendriyas and the spine. The root of all our health is in the spine. So strong, healthy karmendriyas, strong, healthy jnanendriyas, you work them to develop a strong spine, erect spine, and when you get correct spine, samam kayashirogrivam dharayanacham striya, that is definition of meditation. But that spine has gross structural nervous system, all the vertebrae and the vertebral column will be the ortho, asti, in front of that at various locations, and corresponding to the chakras are various neural plexuses, various endocrines. So these are all activated using asanas, using the spine as a tool, using the karmendriya as a tool, and that comes at a later date. So remember, ki this is roughly the seat of where the pancreas is. So because the mention of panchaprana, either panchaprana. There are various divisions of prana. So in your epigastric region is the samana. So in various asanas, you via axis through the spines, you keep these organs healthy. You have to understand that this is internal work. Karmendriyas, you may use archery, use for throwing, that is external work. But in the asana, these karmendriyas, manas, buddhi, ahankar, everything is used for internal work on organs to keep them healthy. So the organ of choice or organ for today's this thing is pancreas principally. So how will you get access to the pancreas? The answer is through asana only. It can be no other way. A surgeon can access through straight away cutting, पूरा इधर incision ले लो, laparoscopy ले लो, you have various other ways you can access. But there is no way you can access. And how will you maintain organic health? One more important question you have to know, that health of organs is dependent on any organ. Diabetes में amputation क्यों होता है? पैर का खून कम हो जाता है. You have to understand that any organ will function if its cell functions. Now that is how, as doctors, we study this physical body. For us, the functional unit is a cell. A group of cells will form a tissues. A group of tissues will form an organ. An organ subserving a system. A subserving common function is called as a system. And a group of system makes a whole. So endocrine system is involved in diabetes, cardiovascular system in various heart diseases. So to keep an organ healthy, you have to keep the cell healthy. The concept of cellular health also should be known. So cells will be healthy and function healthily if, how will a house function? There has to be good income. इनकम आमदनी नहीं है तो घर चलेगा क्या? घर नहीं चलता. For the cells, 300 trillion of cells which make a human body, which is the financial well-being? Or which can make health? That is the blood supply. Now, you understand how asanas function. When you exercise, when you run, what happens? Your muscles of the legs principally work more, and the heart and lungs has to increase the blood supply so that the oxygen and nutrient reaches those exercising muscles. So exercising muscles force the heart to work. That is not cardiovascular exercise. So here in asanas, various organs are manipulated physically in various parts to increase their blood supply, to increase their intactness, you can say, or their position. Abhi, let me put it this way. You must have heard of prolapse, medical students. Prolapse में क्या होता है? The uterus is there. From birth injury, the pelvic or aponic stent goes down and the uterus comes down. So it is displaced from its position. So repositioning organ in its position, giving them adequate space, and then using various physical maneuvers to literally massage, squeeze, turn and expand. So अभी saline लगाते हुए देखा है क्या? That is what a sister will do. So that will temporarily increase that blood supply, and then you start that IV fluids. So various organs are suspected or rather subjected to these maneuvers to increase their blood supply and organic health. Now this concept is not known to medical science, Ayurvedic science, any science for that matter. This is a concept which is given by Guruji. So which are the asanas? I can show the asanas, or probably students है क्या कोई? Practitioner students है क्या कोई? Now, if a patient comes with fasting of 250 and 350, I will do lipid profiles, urea, creatinine, ECG, screening test, sonography, retinography, start a tablet and ask him to come after 10 days. My job is done as a prescription. But asanas is not as easy as prescription. Which of the asanas I will show you for beginners or youngsters, they have to start from this. I'll just, if you can hear, I will show you. Inversions only. For youngsters, you have to have strong arms and limbs. And when you have strong arms and limbs, you can progress further. So this is not for patients. The initial introduction is for youngsters who are full of energy. Believe me, youngster है आता है तो कर लो, they will feel tired and whatever. So this is called as yoga mat. Good, I deliberately asked you, मालूम होना चाहिए yoga mat आया कहाँ से? So much so that people are saying कि अरे mat निकले योगा लगता है. चैला जी ने कुछ बहुत लगता है. We are saying कुछ वगैरह को ये mat कहाँ से आया? Mat you see everywhere. Rubber mat, yoga mat, and आएंगे में इसको sticky mat बोलते हैं. What is that sticky mat? Sticky mat is a tool. You have to understand that these are all props which have been developed by Guruji for feeble people. We are feeble practitioners of yoga. We cannot develop yoga.